Hello, welcome to another educational session by your cardiac rehab staff. Today I would like to talk to you about angina, explaining what it is and what to do if you ever do experience it. Angina is a discomfort in your chest that can occur if your heart is not getting enough blood flow to meet the oxygen demands. In angina, the need for an increased blood flow isn't met for a short time. When increased demand for blood goes away, angina symptoms will go away too. Angina and heart attack have the same cause, atherosclerosis. This is a buildup of fatty substances called plaque in the coronary arteries. If one or more of the arteries are partially clogged, not enough blood flow can get through, and you can feel a discomfort in your chest or chest pain. While the pain of angina may come and go, it's the sign of heart disease and it can be treated. Lifestyle changes, medication, medical procedures, and surgery could help reduce your angina. What does angina feel like? Many of you could probably describe that to me better than I could to you, but the typical symptoms that we hear from people who have experienced that are that angina usually lasts only for a short time, and it usually is a discomfort in the center of the chest or behind the breastbone. However, many people will feel different symptoms, such as a pain going down one or the other arm, usually the left arm. It could be a very heavy pain. It could be a stabbing pain that goes through from the front of your chest through to your back. Some people feel like they're out of breath when they experience this. Others describe it as a pressure or squeezing or burning in their chest. And some people say that the discomfort will spread or radiate to their arm, back, neck, or jaw, or even to their stomach. Some people experience numbness or tingling in their shoulders, arms, or wrists, and then others do feel a little sick to their stomach. When does a person get angina? It's going to be at a time when they are putting a bigger demand on their heart and the blood flow it supplies. So you may notice it when you're doing something that's heavy or strenuous, such as climbing stairs or carrying groceries. Emotional upset or getting angry could also increase the need for blood flow. If you're working out in the extreme heat or cold temperatures, then that could also cause an angina episode. If you eat a big meal or during something like having sex, which does increase the blood flow, emotional stress, or exercise, that could bring on the feeling of the discomfort in your chest. If you are suspected to have some angina, once you see the doctor, he may run a few tests. He may do some blood tests to see if there are any enzyme levels indicative of heart problems. He may run an EKG. He possibly could have you do an exercise stress test of some type, which could lead to a heart catheterization and also a coronary angiogram where they would inject dye into the arteries of the heart to look to see if there is a blockage. So once they determine you may have angina, what do they do? How do they treat it? The doctor might give you some nitroglycerin. Nitroglycerin is a powerful medicine that can help open up arteries to help blood flow get through the arteries a little more easily. It's a medicine that can relieve or prevent chest pain from angina. Nitroglycerin comes in the form of a tiny little white tablet that you place under your tongue. It also is available in a spray form, and some capsules or skin patches or ointment are also available, but the most common one we see are the tiny white tablets that are placed under the tongue. If you do take nitroglycerin, you always want to make sure that you have a fresh, sealed supply in the bottle that is given to you. Always keep the tablets in the original bottle. Exposure to the heat, light, or air can make them break down quicker and be less effective. The nitroglycerin tablets could possibly cause you to have a headache or for you to feel lightheaded once you take them. So I do recommend, if you do use nitroglycerin, that you do sit down and when you're going to place them under your tongue. Make sure that you ask your doctor every 6 months to give a refill on the prescription of nitroglycerin. The tablets do break down quickly, and if you're using old tablets, they could not have as much strength as a fresher tablet. Your doctor may tell you to take one just before you start an activity if you are somebody who does have chest pain when you do activities sometimes. Also, you should take a tablet if you have discomfort that doesn't start to go away within a minute or two after you've stopped an activity, or the pain occurs when you're not active. Then you could use that nitroglycerin. What can you do about angina? You could change your way of life and lower your chance of having any angina attacks. A few simple steps may help you feel more comfortable every day. Stop smoking if you are currently smoking, and if you don't smoke, avoid secondhand smoke. Eat healthy meals that are low in saturated fat, trans fat, and salt. Controlling your blood pressure can be an important way to manage angina, and also managing your blood cholesterol levels by eating healthy and exercising, and taking medicines if they're prescribed. You want to avoid extreme temperatures because extreme temperatures make your body work harder to regulate your internal temperature, and that can cause some angina. Also, avoid extremely strenuous activities. While we do want you to exercise, we don't want you to overdo and make things hard on your body. Learn to relax and manage any stress that you may have. And call your doctor if you notice any changes in your angina, if it's becoming more frequent, if you notice that it is more intense, if it happens when you're resting where it didn't before. Those are signs that you would want to let your doctor know that that's occurring. There are a few more resources here at the bottom from the American Heart Association. There's a number for them. And of course, any questions that you have, please ask your cardiac rehab nurse, and we'll be happy to speak with you about your concerns. I hope to find you're having a great day today, and I look forward to seeing you back in cardiac rehab. Thank you.